SulAmérica. Hello, good afternoon, everyone. It is a pleasure to be here with you in another panel in which we will discuss, talk, and learn more about such a fascinating market, which is the health market in Brazil and in the world. First, I want to thank FIS, Rodrigo, for the invitation to be here. And I wanted to thank my dear friends who accepted this invitation to be part of this conversation, Heitor, Augusto, and Lior Baruch. I wanted to start by sort of breaking the ice and moving away from our protocol. I wanted to dedicate this conversation to Dr. Eliud Baruch, who passed away last week. He's the father of our colleague Lior Baruch. And Dr. Shoshana, he really insisted for Lior to be part of this panel. To both of you, I wanted to say that your son, whatever you are, is an amazing person. He's a spectacular person, and we learn a lot from him. We exchange so many ideas. So congratulations for this amazing son that you have. My dear friend, I know this is a very tough moment for you, and thank you so much for joining us, regardless of this difficult moment you're going through. Having accepted to be part of this conversation, we are very thankful for that. And Mrs. Shoshana Baruch, this presentation is for you and to Dr. Rodrigo Baruch. Okay, my dear colleagues, let's talk about the topic of today's conversation. And the idea here is to discuss everyone today speaking about health insurance. And with the pandemic, all of us either began to understand more about this topic, or at least try to understand more. And I think that the result of that is anyone who thought we understood anything about the topic, we don't. We realize that we don't. And we are going to talk about the world market, where Lior is very much present. And Heitor, Augusto, is also an expert, focusing mostly in the Brazilian market. And we know that in recent years, we are seeing some difficulties in this management, so that we can care for people, we can care of people's health, knowing that cost is an increasing cause for concern, mostly in the Brazilian market, where we have an instability in the number of people who have access to this system. So costs are completely divided, and the number of beneficiaries or users remains stable, mostly because this is connected to the economic development of our country. We know that we need all stakeholders to work together so that we can create a more sustainable health market. So after this introduction, I wanted to briefly talk about my dear friends, and then you're going to have the floor. so that they can tell you a bit of the experiences that they've lived and their learnings, and how our collaborative model can be improved so that we keep on working for many years to come in a market that needs to be sustainable. So Lior Baruch has an amazing CV, and I am proud to be able to read it. He's lived in 4 different countries. He's fluent in 5 languages. I met Lior in a conference in Berlin where I watched his presentation, and I heard him speaking for the first time. I was wooed by his presentation, and we became good friends. He joined Cigna in 2012. He works with the global departments at Cigna. He was medical director, well-being director. He was the director of the network of providers. And he's also led global programs for emergency. He has broad knowledge about the health problem in Latin America, and he has been key to support several partners in the business matrix. Before Cigna, he was a medical manager at another insurance company, health insurance company. He began his career in Brazil, then he moved to Dublin in Ireland, where he worked to expand the network of providers and in managing complex cases globally. He has expertise in the health insurance sector, and he is also a surgeon, a trauma surgeon, and he has also worked in emergency services in São Paulo. You have the floor, Lior, my dear friend. Thank you, Eduardo. Thank you for the beautiful words you've said, and thank you for the invitation. It is a pleasure to be here sharing this panel with the dear friends that I see on the screen, and it's a pleasure to be here with everyone that's watching. I think this is an opportunity for me to learn, because listening is maybe more important even than speaking. Since we don't have a lot of time today, I'm going to try to be brief. 2019, before the beginning of the pandemic, health insurances was the segment of the insurance sector that grew mostly in the world, 6.9% when compared to 5.9% in 2018. And of all collected premium around the world for different types of insurance, health was responsible for 26% of this whole pie, insurance pie. And back then, the conversation was a bit different. We were talking about how to integrate different costs in health insurance. How can we create a less fragmented ecosystem, a less isolated ecosystem, and bringing value-based healthcare? And this was a conversation that that had been going on for many years, with different creative ways to add value to a local health insurance watched or covered by the global health insurance. And how can we be ahead of competition? Every year in the US, where I am right now, if we use 2018 as an example, we received 50,000 requests of quotes to serve clients. And in the blink of an eye, 20,000 of these requests, 40%, were declined. They did not even do an actuarial study because we could not serve the client's needs with high quality as the clients received, providing value for the premium that they pay. And what do I mean by providing value? Well, we have to be able to show that there are going to be safe costs. We have to show the network of clinics and services and drugstores and pharmacies, looking at fraud combat. And that was the second year of our telemedicine program, in which we used an app. And in the company, everybody was wondering, why aren't people using telemedicine that much? We knew about the positive impact and the value that telemedicine could bring. Well, late 2019, early 2020, the pandemic hit. And I think that the legacy, as you mentioned, you used this word, the legacy left by the pandemic was telemedicine. In Brazil, we saw the reform of this regulation and the boom of the use of the use of telemedicine. In Brazil, there was an increase in 4 percentage points in the use of telemedicine. And the more people use telemedicine, the more value patients see. Patients need primary care, and they could avoid going to an emergency room in the middle of a pandemic. I know it sounds obvious, but when the pandemic was hitting hard, who would be willing to wait for service in an emergency room because they had a sore throat? And people were dressed as if they were ready to face a surge of Ebola. So people really started realizing the value of telemedicine. One of the challenges was to provide assistance and services in a world that came to a stall. Our clients, they had to be transferred to an excellence center in the case of an emergency, should the level of local care be inappropriate or insufficient. And I clearly remember of a patient who was in Vietnam. He had a hernia, a disc hernia. He needed to undergo surgery, and we could not transport this person to the nearest center of excellence because the frontiers of countries were shut down because of sanitary measures, health measures. And that was an extremely dramatic case for us. Luckily, let's use this word, luckily this person was a US citizen. He had to cross the world, fly across the world, go to Texas to receive surgery. Another challenge we face is one that shows the consequences, which is search for chronic diseases and catastrophe diseases for this type of healthcare. Patients took a while to search for help because they were afraid of the virus, or we've had some late diagnosis that appeared, delayed diagnosis, and we know that the sooner we have the right diagnosis, the greater are the chances for a healing treatment, an effective treatment. So I think we will still see the impacts of these delayed searches for care. In the beginning of 21, we had the beginning of mass vaccination. And as we have vaccines being distributed around the world, there was the equation that was going on. And now we add more complex challenges. Patients with what we call prolonged COVID, people who avoid the vaccine, and also the need to fight fake news, using science, which has been complicated. And we can even speak about a new pandemic, which is a mental health pandemic. I just wanted to add that regarding prolonged COVID, almost 1 out of every 3 patients that had the disease and did not go to hospital, they're still complaining about fatigue, loss of the smell sense or of the taste sense months after the diagnosis. And these patients will still need chronic rehabilitation services, which is quite a complex service, and we have to support these patients. Regarding vaccine hesitancy, the World Health Organization brought a lot of information in a very simple and accessible language to the whole of the population, fighting fake news. And, I would say the BS even that has been shared through social media. We were looking at terrible fake news, and the despair together with ignorance, they succumbed to this type of rhetoric. In Zimbabwe, I heard that some people were refusing to even think about taking a vaccine, and they say that it was a white people thing. This is for white people, just like HIV. And what we believe it's going to be a difficult challenge to manage is the current mental health pandemic. How can we provide the necessary care to fight the mental health pandemic? And this is not just about a clinical program for clients showing what are the health service providers that we have, or providing new apps. Actually, how can we engage patients? How can we attract patients when patients need to treat a mental health problem? Oftentimes they are not even aware that they need treatment. 1 out of every 4 people will have depression, and they are not even aware of that. mental health is not something isolated. It's part of a package called holistic health. That's the psychological, physical, and social well-being of people. Just to finalize my comment, I wanted to bring up a topic that might fuel our debate this afternoon. Physicians who know their patients, are they capable of identifying these symptoms of mental health problems beforehand, which would then allow to provide more effective services? I do believe yes. The answer is yes. But as I said in the beginning, I want to hear from you, my colleagues, and I think this is going to be an amazing conversation. Lior, yes, as usual, you are a professor. Just making a brief comment before I give the floor to Heitor, Augusto, you mentioned 3 key points that I wanted to sort of highlight with a yellow marker, quote unquote. And these are things that draw my attention. I believe we are undergoing a perfect storm when it comes to the use of health services. And why do I say that? Well, we still have a remainder of the COVID pandemic. We have elective surgeries coming back because, you know, the economy came to a halt for physicians and health service providers who provide elective services or elective surgery. And we also have, as you mentioned, treatment. If we forget OG and some cases that needed to keep on being cared for, all other groups of diseases and treatments came to a halt, and there was no appropriate prevention or follow-up during the pandemic. So now we are seeing more severe cases coming to our offices. And that, of course, elevates costs and elevates expenses, medical expenses. And I also agree with what you said about the post-pandemic period and mental health issues. You know, you can call it burnout, you can call it stress, but this is a very serious problem. It's a silent disease, and oftentimes it's very difficult to identify it. And together with that, engagement, as you mentioned, engaging patients. I think this is a huge difficulty. I usually say that we currently have 4 generations in the labor market. Soon we will have, I don't know, 8 generations. And they have different perceptions, different values, different purposes, different goals. And we have one single way to communicate with all these patients. How can we expect to have different outcomes or different reactions if we have one single way to communicate with people who receive the information in a different way and who have different goals? So yes, this is a challenge that we are facing. And I think it's important to talk about this, to exchange ideas so that we can search for a common ground. Or, you know, I know that we have the car going at high speed and we have to step on the brakes, so otherwise we are going to hit the wall. And we need to do that to be sustainable. So thank you once again for your words. And Heitor Augusto, you are another great friend. He's been working for 25 years at SulAmérica. He has a degree in business administration. He has an MBA at the FGV University in São Paulo. He leads the commercial and client relationship area at SulAmérica Seguros, a SulAmérica insurance company. He probably started working when he was 12. I don't know. He probably joined as a trainee. Anyway, he is a dear friend and an expert in this industry. It is a privilege for me to, you know, be constantly exchanging ideas with him. Of course, we do business together, but I think we have a common philosophy and common values. We are looking at improving our health insurance market so that it's more sustainable, of course. Heitor, I give you the floor, and please tell us a bit about your experiences and what you've lived during the COVID pandemic. What have you learned What have we done, and what do we still have to do looking forward? Thank you once again for accepting our invitation, and you have the floor.
Edu, first, I'd like to thank you for the invitation. And Lior, it's really nice to meet you. I'm sure we're going to have the opportunity to have lunch together and further our discussions. Lior already mentioned some very important aspects of what I'd jotted down as a priority for our conversation. And well, talking about the pre-pandemic scenario, we know that this crisis is going to bring about change for the entire market, the economy, and society. And it's had an impact on the way we live, the way we act, the way we work. I think we all noticed that both companies and professionals, I mean, the insurance companies have had and still have a very relevant role in the market, which is one of offering safety to the population. This has increased the perceived value, in my opinion. Some cases that Leo touched upon, Cigna's challenge is much greater than that of SulAmérica. We do have our own regional challenges. We are present in many places in Brazil. And, well, I can only imagine you with your much more scattered population. And the pandemic brought about this huge challenge in terms of the insurance companies being able to manage their plans. So several removals have certainly saved lives. I saw this very intensely with my customer relations team, transferring people from Manaus to Brasilia, from Brasilia to São Paulo, and whatnot. And I mean, so many lives were saved. So in its moments like this that end up drawing people's attention to the fact that it is important to protect whatever they care about. So our reality, and Lior, I think you know that very well. You lived here as well as Edu, but we should not forget that we have some challenges such as judicialization and population aging, which is putting more and more pressure on us. And young people, they're increasingly not adhering because we have financial compensation. The retraction that we went through in our sector in the last 3 years, the total number of beneficiaries of medical plans and hospitals has decreased by almost 3 million users. And I have some good news for you. Today, the agency disclosed information about the September data. In 1 year, we grew by 5 million, over 5 million beneficiaries, 3.3% as compared to September 2020. And we hit a record in terms of the number of registries. We had 48 million beneficiaries. Now we have 48.566. So this is the highest number of beneficiaries we've had so far, coming from a huge retraction, which is, of course, a sign of an economic recovery. The growth was not in terms of individual or collective health plans, but rather it was seen in business plans, collective business plans. And with that, we see that the economy is starting to recover as a result of the strong vaccination campaign in Brazil. Brazilians traditionally like to vaccinate, as opposed to some other regions in the world, such as in Europe, for instance, where they're facing the risk of a new wave of infections. And going back to the subject matter of this discussion. The incorporation of technology is always putting pressure on costs. There's X-ray, but there is CT scans and MRIs. And of course, this puts pressure on costs. Our inflation is always going to be higher than the general inflation rate. And I think we should keep an eye out for that. Fraud, that's something that's highly prevalent in our reality. We have anything from excessive, unnecessary treatment to low service quality or inadequate selling of materials and medicines, tax evasion, fractioning invoices. Many people don't know that that's a fraud, and that also puts a lot of pressure on the sector. Around 20% of the cases in supplemental health come from fraud or waste. And there's one thing that Lior talked about, which is the compensation model. And what we see most frequently is the fee for service model that rewards for mistakes and generates complications and poor results overall for the model. Here we created demand for service because the more you do, the more you earn. And I speak on behalf of SulAmérica, but we're implementing more and more differentiated compensation models. The market's been working, the hospital chains have been starting to understand the need for changing the model because, in fact, consumers are putting pressure on us towards presenting more sustainable models. And this is also related to compensation and service providers. I think the market has to evolve more towards a greater transparency of costs and prices. Maybe this could be a way for beneficiaries to choose more efficient providers. And we have to discuss that. And Lior, you mentioned engagement. I think that engagement of beneficiaries is fundamental, especially when it comes to primary care, secondary care, and changing our model and changing our culture. That's important, but the engagement of the stipulants is also very important, and they have little participation in the discussions. They have almost no interest in transforming the market, so probably they could be more active in those discussions and require more information from the operators, become protagonists regardless of the hiring model, and working in Brazil. I think that very few companies face healthcare management as grown-up people. So well-being of collaborators and engagement and engaging them in self-care is a fundamental part of this transformation that we still have not achieved, which is very important for people. I think that HR has to see that as what they want to deliver to its employees, to its to the family members of their employees, and so forth. And the HR is increasingly losing strength. The procurement department, I have nothing against them, but they're not specialists in that segment. So they put unnecessary pressure if we talk about the procurement model. And I think that the operators themselves, maybe we could work better in that regard in terms of the management of healthcare services. And we have several players that are very important for that with us. Going back to another subject that is also challenging, in my opinion, apart from the GDP and the job positions and the number of beneficiaries, I think there is a change in consumption habits with the increase in available technology. And we were able to use that in a very accurate manner, in that we were able to turn our attention to telemedicine. At SulAmérica, we had a service even before the regulation came about, which we called a medical screening. And just so you understand, Lior, we were already challenging the model at that time with telemedicine in a very shy manner due to the absence of regulation, but we already did some screening for simple questions from our beneficiaries, but with no prescription. So it was not really a medical visit. And we had more or less 2,000 people looking for that service per month. With the pandemic, we went over 100,000 services per month. And we were really able to leverage that technology and really give that support to our beneficiaries. And that continues. Even with the recovery, of elective services, what we can tell is that the population likes telemedicine, and we have to provide that. And Lior, I don't know how you've been dealing with that, but Brazil used to be a country where people would frequently go to the ER, and even mothers would go to pediatricians through the ER services. But of course, that was a totally mistaken way of looking at it. I think that the pandemic showed to us Brazilians the risks of being inside an emergency room and exposing your kid to a situation where other kids and other patients are there with other diseases. And we saw that that is becoming less common. So that is a positive impact of the pandemic in our case. I think we shouldn't miss the opportunity. We have to continue encouraging people to only go to the emergency room if they have an emergency. And as a market, we can create mechanisms along with hospitals to deal with these situations. And to live through the pandemic, talking about the backstage a little bit, we created several ways to steer the beneficiaries away from ERs. We did a fast track methodology where the beneficiaries did not have to wait in line in an ER. They would go to an ER that we would refer them to with a pre-filled registration form, and then they would be screened, and that would prevent them from having to be in the same room as other beneficiaries, thus avoiding contamination. And that's something that we maintained as a delivery that we deliver to our beneficiaries. And there's also several other things. Technology, of course, helped us a lot, and service providers, the fact that they are able to understand this new moment that we're in right now, such as home delivery, for instance, of medicines. That's something that we also offer, avoiding patients from going to hospitals. At home blood collection, we led this initiative, and this will also prevent beneficiaries from unnecessarily going to a lab. And just to wrap up, and I'll give the floor back to you in a minute, we've always tried to keep our beneficiaries at the center of our perspectives, regardless of where their point of contact is. They're all going to be connected constantly within our coordinated care initiative, which is an initiative that deals with primary care. And we've always tried to keep beneficiaries at the center of every situation and clinical outcome, regardless of the situation that we're now experiencing. Thank you. I learned a lot from you. Time flies. We only have 5 minutes to wrap up. But I think, as you said, we have several problems and we need to raise greater awareness and engagement. We have to discuss judicialization. We have administrative problems of not including procedures into the list of procedures, and this interaction between procurement and HR. And all of these problems leave all of the parties involved unhappy, consultancies, businesses, beneficiaries. So we need a coordinated action across the sector. I don't know if we have time, but I want to start the conversation and ask you to say some final words about my last comments, which is primary care and in such a fragmented sector, how we could avoid incurring more costs and maybe having telemedicine more prevalent, but as a deeper form of medicine with family doctors at the top of the chain in the private market, so that this culture can then be disseminated to all beneficiaries, and as Edu said very well, generating greater engagement by the representatives of collective insurance policies. But anyway, that's food for thought. I'd like to once again thank you very much for the excellent discussion. Unfortunately, time flies. Lior, once again, thank you so much for your availability and for your knowledge. Heitor, thank you as well for being with us in the middle of your vacation. So you have a minute each, Lior first and Hector. Thank you very much. Thank you for watching us. Lior, you have the floor. Thank you, Eduardo. In 60 seconds, I want to highlight the positive aspects. Talking about Brazil specifically, we're seeing an initiative where we have products around a healthcare team revolving around a primary care physician. We don't need an endocrinologist to treat diabetes. We don't need a cardiologist to treat high blood pressure. We don't need an endocrinologist to treat obesity. 27% of the Brazilian population is obese. This is a huge leap if we compare today with the situation 20 years ago. So this physician at the center of the team will be responsible for making the connections. And of course, he or she owns the patient. And then they'll consult with a specialist. Then the patient will come back. So this physician will be providing a holistic care to their patients. There's a lot to be said about that, but let's park the conversation and discuss it at a different time. Thank you for the invitation. It was a great discussion. And in closing, and picking up on what Lior said, our perspective is that primary care takes care of health in general by creating a connection between patients and the medical teams that will follow those patients throughout their lives. And that's the message that we've been advocating for under our coordinated care initiatives. Talking about cost, that was something that we were talking about the other day, but we cannot yet measure accurately, but we know that according to the WHO, preventative care like these are able to cater to 80% of patients' demands, like Lior said. And in addition to that, according to the World Bank, you can reduce the number of hospitalizations by 17%, 29% of emergency and urgency services, and 30% of hospitalizations. So that's what we believe in. That's the take-home message. Congratulations on the event, on the choice of subjects. Probably the subject in itself would deserve 3 or 4 hours worth of discussion, but I think it was quite good in that we were able to share our perspective. So yeah, see you next time. Thank you. Thank you very much.